morning. Thank you, Brother Ra. My topic for this morning, as requested, I need permission to share my screen, please, is going to be on menopause, something that many have asked about. And the women are excited to hear about menopause, but did the men know that they also get menopause? And we're going to talk more about that this morning.
60 past 7. What up, 60 past 7?
So what is menopause? Menopause is a stage in life when you stop having your monthly period. It's defined as a complete year without menstrual bleeding in the absence of any surgery or medical condition that may cause bleeding to artificially stop, such as hormonal birth control, overactive thyroid, hyperlactin, radiation, or surgical removal of the ovaries. It is a normal part of aging and marks the end of your fertile reproductive years. Menopause typically occurs in your late 40s to early 50s. However, people who have their ovaries surgically removed undergo what's called sudden surgical menopause. Do men go through menopause? The answer is yes. For men, it is called andropause, or male menopause. It's a term given to describe decreasing testosterone level in men. Testosterone production in men declines much more gradually than estrogen production in women, at about 1% per year. Healthcare providers often debate calling this slow decline in testosterone menopause, since it's as drastic as a hormone shift and doesn't carry the same intensity of side effects as menopause in women. Some men will not even notice the change because it happens over many years or decades. Other names for male version of menopause are age-related low testosterone, male hypogonadism, or androgen deficiency. So ladies, you're not alone. Let's shed some light on andropause before I go any further on menopause, like how different it is from menopause. In menopause, the hormone production of women plummets and stops completely at a relatively short period of time. Testosterone decline in men, however, happens again over a long period of years. Furthermore, the testes of men never really stop producing the substance needed to make testosterone, and men can reproduce well into their old age. What are the symptoms of the andropause? They have sexual problems, fatigue, or the feeling of being tired at all times, changes in sleep patterns, reduced muscle mass, and increased body fat, weakness, and depression. Both occur at or around age 50. Here is a picture showing an andropause of how the testosterone levels in men decrease. It's high at 25 and it starts to decrease as you get older. So let's talk about the menopause that I've asked to speak about. Why does menopause occur? As you age, the reproductive cycle begins to slow down and appears to stop. This cycle has been continuously functioning since puberty. As menopause nears, your ovaries makes less of a hormone that is called estrogen. When this decrease occurs, your menstrual period starts to change. It can become irregular and then stop. Physical changes can also happen as your body adapts to different levels of hormones. The symptoms you experience during each stage of menopause, perimenopause, menopause, and postmenopause are all part of your body's adjustment to these changes. And here's a photo to show the levels as they decrease from age 20 up to age 80. What are the symptoms of menopause? You may be transitioning into menopause if you begin experiencing some or all of the following symptoms. Hot flashes, also known as vasomotor symptoms, a sudden feeling of warmth that spreads over your body. Night sweats or cold flashes. Vaginal dryness, discomfort during sex. Urinary urgencies, difficulty sleeping, emotional changes, mood swings, mild depression, dry skin, dry eyes, or dry mouth. Other symptoms: breast tenderness, worsening of premenopausal syndrome, irregular periods or skipping periods, periods that are heavier or lighter than usual. Some people may also experience racing heart, headaches, joint and muscle aches, and pains, changes in your sex drive, difficulty concentrating, memory lapse, weight gain, hair loss, or thinning. These symptoms can be a sign that the ovaries are producing less estrogen or a sign of increased fluctuations in hormone levels. Not all people get all these symptoms. However, those affected with these new symptoms of racing heart, urinary changes, headaches, or other new medical problems should make sure there is no other cause for these symptoms. The signs and symptoms, again, there's a lot of them. And here are the similarities with menopause and andropause. Mood swings, both parties get mood swings. Both can get depressed, both can have headaches, both can have night sweats, both can have trouble sleeping, both can have weight gain, and both can have reduced sex drive. Stages of menopause. The perimenopause phase can begin 8 to 10 years before menopause, when the ovaries gradually produce less estrogen. It usually starts when you're in your 40s. Menopause is a point when you no longer have your menstrual period. At this stage, your ovaries have stopped releasing eggs and producing most of their estrogen. Menopause is diagnosed when you've gone without a menstrual cycle again for 12 consecutive months. Then you have the postmenopause phase. This is the name that is given to the time after you have not had a period for an entire year. During this stage, menopausal symptoms such as hot flashes may ease for many people. However, some people continue to experience menopausal symptoms for a decade or longer after the menopause transition. As a result of a lower level of estrogen, those in the postmenopausal phase are at increased risk for several health conditions, such as osteoporosis and heart disease. Some may have even what's called premature menopause. That happens before the age of 45, and that's called early menopause. But some people do have that. Menopause that occurs at 40 or younger is considered premature menopause. When there is no medical or surgical cause for premature menopause, it is called primary ovarian insufficiency. How is menopause diagnosed? There are several ways your healthcare provider can diagnose menopause. The first is discussing your menstrual cycle over the last year. Again, as we discussed, has to be a full 12 months straight without your period. So they go through the signs and symptoms that you have experienced mostly. Can menopause be treated? Menopause is a natural process that your body goes through. In some cases, you may not need any treatment for menopause. When discussing treatment for menopause with your provider, it's about treating the symptoms really of menopause that disrupt your life. So there may be two main types of treatment: hormone therapy or non-hormonal treatments as well. What is the hormone therapy for menopause? There are two main types. There's estrogen therapy and there's estrogen, progesterone, progestin hormone therapy. In estrogen therapy, it is a treatment. Estrogen therapy is taken alone. It's typically prescribed in a low dose and can be taken as a pill or patch. Estrogen therapy can also be given to you as a cream, a vaginal ring, gel, or spray. This type of treatment is used after a hysterectomy. Estrogen alone can't be used if you still have a uterus. In the progesterone therapy, this treatment is also called combination therapy because it uses doses of estrogen and progesterone. Progesterone is available in its natural form and also in progestin. This type of hormone therapy is used if you still have your uterus. Hormone therapy can relieve many of the symptoms that many people have when they have menopause, including irritability, mood swings, vaginal dryness, hot flashes, night sweats, and hair loss. Are there any risks in taking hormone therapy? Like most prescribed medication, there are risks for hormone therapy. Some known to health risk factors include endometrial cancer, gallstones, gallbladder issues, blood clots, deep vein thrombosis, pulmonary embolism, and stroke. Are there any risks again taking as I can continue? These risks are lower if you start hormone therapy 10 years of menopause. After that point, your risk for cardiovascular disease is now higher. A correlation exists between severe hot flashes, night sweats, and your risk for cardiovascular disease. Healthcare providers may suggest starting hormone therapy if you have these severe symptoms, since it's an indicator for future cardiovascular risk. Going on hormone therapy is an individualized decision. Discuss all past medical conditions and your family history with your healthcare provider to understand the risks versus benefits of hormone therapy for you. What are some of the non-hormone therapies? Though hormone therapy is a very effective method for relieving menopause symptoms, it's not the perfect treatment for everyone. Non-hormonal treatments include changes in your diet and lifestyle. These treatments are often good options for people who have other medical conditions or recently have been treated for breast cancer. The main non-hormonal treatments that your provider may recommend include changing your diet, avoiding triggers to hot flashes, exercising, joining support groups, and prescription medications. Sometimes changing your diet. Plant estrogen diet is good. It's not a replacement for the estrogen made in your body. But you can take foods like soybeans, chickpeas, lentils, flaxseed, grains, beans, fruits, and vegetables. Living with menopause. Some people may experience trouble sleeping through the night and insomnia during menopause. This can be a normal side effect of menopause itself. If hot flashes keep you awake at night, try staying cool at night by wearing loose clothing, keeping your bedroom well ventilated, avoiding certain foods and behaviors that trigger your hot flashes. If spicy food typically sets off a hot flash, avoid eating anything spicy before bed. What are the long-term health risks associated with menopause? There are several conditions that you could be at risk for after menopause. Your risk for many conditions depends on many things like your family history, your health before menopause, and lifestyle factors. Smoking is one of them. Two conditions that affect your health after menopause are osteoporosis, like I spoke about earlier, and coronary artery disease. Osteoporosis, if you don't know, is considered brittle bones disease. And this occurs when inside the bones become less dense, making them more fragile and likely to fracture. So you want to make sure that you're staying on your calcium as well and your vitamin D. A reminder, menopause is a natural and normal part of the aging process. Once you are in menopause, you have gone 12 months without your menstrual period. Too often, myths foster misconceptions about this normal process of aging. Although menopause can cause some noticeable and uncomfortable changes, these can be effectively managed. It is common to experience these symptoms. Be open with your healthcare provider about the symptoms you're experiencing and how they impact your quality of life. They can recommend treatments to manage your symptoms and make you more comfortable. I want to give special acknowledgement to the Cleveland Clinic, Dreams Time, and Balance Medical Solutions for the information that I was able to share with you today. If there's anything that I did not cover in my summary and you have any questions, I ask that you join us in the Zoom room where I'll be happy to answer those questions for you. Thank you so much. God bless and enjoy the rest of the service.